Hey everybody, welcome to this Caregiver Coffee. My name is Matthew Estrad, and I'm a gerontologist in St. Tammany Parish, making these videos and partnering with Coast for many years. And for 10 years, I've been the Caregiver Support Group Facilitator. I'll tell you a little bit about that. And but today's topic is going to be, we'll continue medications. Remember, we're going through all the four M's, what matters, medications, mentation or mind, and mobility. And we're going to go through all of them and in a series of videos. So right now, this is the second one of medication. So hopefully you got to see the first one where we talked about we are continuing. We started the this article on medication from the National Institutes on Aging. So we'll continue that here. Before we get into that, just know about our caregiver support group. No matter when you're seeing this, just know that typically it's on a Tuesday that we meet, a Tuesday evening from 6 p.m. Central to 7:30 p.m. Central. Sometimes we're in person, sometimes we are virtual. Now there is a pattern. The first and third Tuesdays of the month are in person, and the second and the fourth Tuesdays, and sometimes the fifth Tuesday we are remote. We're on the Zoom platform where you can just call in using a landline computer, landline phone, or your smartphone. But it's important to get the calendar that we publish every 2 months because sometimes there's a holiday falls on a Tuesday, so sometimes Christmas is on a Tuesday. Mardi Gras is always on a Tuesday, and most of the time we don't cancel, we just move it further into the week, like on Thursday after Mardi Gras. So make sure you check that out. And you can also get on our email list, our private email list, where I send a reminder every Tuesday morning of where we're going to be, the address, or if we're virtual, you'll get the Zoom link, etc. It's always the same Zoom link, has been for years, and you also will get that new flyer every 2 months. So, and if you don't subscribe, you just go to the website or call the Council on Aging in St. Tammany. So with that, let's go ahead, jump back into this really good article. We're about halfway. It's a very comprehensive and long article, which is great. And there's lots of even hyperlinks that I'm not even going into. So there's going to be even more information. So hopefully that's not overwhelming, but you just see it as an opportunity for more information and learning and just kind of spread it out as long as you want to. Typically, these videos are 15 minutes long. We try to keep them brief, but certainly there's a lot more to explore. Since remember, I'm not reading these word for word, I'm hitting some highlights. Some things are verbatim, but mainly these are highlights answering your questions. So if you only watch the video and don't go to the articles, that might be fine because we are covering a lot of ground. But I think you'll gain a lot more if you print these out or you download and read them online. Certainly, please share this information. All right, getting back into it. Medications and traveling. When you travel, your healthcare provider may recommend that you adjust your medicine schedule to account for changes in time zones, routine, and diet. That is very interesting. Ask your doctor or pharmacist about these changes before you depart. Carry a list of prescription drugs, over-the-counter medications, and supplements that you take, and phone numbers of your doctors and pharmacists. When you're flying, carry your medications with you. Don't pack them in your checked luggage. We know what could happen to our checked luggage. Take enough medication with you for that time that you'll be away, plus some, in case you have any delays in where you're going, especially if you're going overseas. Um, and make sure you keep medicines out of heat and direct sunlight, both at home and especially when you're traveling. So hot cars, things like that. Just beware of that. Keep it in your purse or backpack if you're doing tours and stuff like that. If you're not able to leave it at the hotel or the room or anything like that. Medication side effects. So this is huge. These are unwanted and unexpected feelings that occur when you take your medications that were prescribed to you. So they're called side effects. They can be minor, such as a headache or dry mouth, though no one wants those things. but they can also be life-threatening on the other hand. And this could be severe bleeding or damage to your liver or kidneys, things that you may not even, sense in the moment. And they may also affect your driving. Some medications, side effects may appear when you start taking the medication, but get better over time. Others are once in a while, but sometimes if the effects will be ongoing if you're on the medication. And if you're having uncomfortable side effects, don't stop taking your medications before you talk with your doctor, if possible. And sometimes it might be unbearable, but just try to get in touch with your doctor and try to not change anything until you talk to them. So, or ask for a nurse practitioner or visit the pharmacist if you can't get in touch with your doctor. So yeah, just some caution with that. I know that on the labels, there's typically a list of common side effects, and sometimes it's 10% of people who take that medication. With some others, it might be 50% or higher of people that have stuff even like diarrhea and things like that. So you really have to weigh these things. Um, watch for those symptoms. Keep your doctor informed, of course, and then for long-term use of that medication to really weigh the benefits of that the medication promises with the side effects that you personally might be feeling. And of course, there might be a list of side effects on the label, and you may not experience any of them. So in the end, stay in communication with your doctor, your nurse practitioner, your pharmacist about that. They may be able to prescribe a different medication that does the same or similar things of what they prescribed you and it causes the side effects. And you might tolerate that better. So work with them on that. Then we have the question of generic or brand name. What is the difference? A generic drug is a medication that is created to work the same way and have the same effect as the already marketed brand name. As you may already know, or many of y'all know, a company invents a drug, um, they are protected for a certain amount of time before other companies can mimic that compound and put it out and under their own name, under a generic name. Uh, so generally speaking, generic drugs and their brand name equivalents contain the same active ingredients, which are parts of the medicine that make it work. A generic drug is just as safe and is of equal quality and strength as a brand name. You may take the generic drug, much like the brand name drug, and they're usually less expensive. I can speak from personal experience that I was on a generic medication, and after a while, the doctor recommended that I try the brand name, and it did work a little better. So you're in a while this article says that they do have the same active ingredient, it may affect your body differently, better or worse. So just keep that in mind. Listen to your clinician who has the experience. Look up research studies, and very importantly, just monitor how you feel compared to other ones. So some good advice from this article on that. Keeping track of your medications. This can be challenging, especially as we get older, because generally speaking, our list of medications gets longer. So it's important to write down all the medications that you take, and there's a link um, to a sort of a tracker, a paper tracker worksheet of tracking your medications. So you want to track all your medications, know what you're taking, including the over-counter, including the supplements, including vitamins, etc. Is to include the name of the medicine, the amount that you take, the times that you take it, time or times. If it's a prescription, note the doctor who prescribed it and why they prescribed it. And always bring this list with you. Show it to your physical therapist, show it to your dentist, or at least offer and say, hey, would you like to see what medications I'm on? Keep a copy at home, keep one in your wallet or your purse. Of course, you can always do this electronically. You can do this in a Google Doc or a Google Sheet, and you can sort of mimic the spreadsheet that they have here, this table that they created. put it in a Google Sheet, and then if you have the Google Sheet app on your smartphone, you can just pull it up anytime. Get familiar with your medications. If you take more than one, make sure you can tell them apart by their size, by their color, and by the number or letter that's imprinted um, on the pill. If you've not noticed that before, try to notice that there's usually a number on that is on the pill. It's stamped or written on there. Save all the information that comes with your medicines. Keep it in just like a file folder. Put that away for reference later. So this is like the booklets that come with with that with the drug. Check expiration dates on bottles. Don't take medicines that are past their expiration, or at least ask your doctor about that. And your doctor can tell you if you need a refill or not. And many times, portal messages. There have been times in the past when I needed a refill and I've let the doctor know, and sometimes they need to see me. They need me to come in to assess me before refilling for legitimate reasons. And sometimes they're able to just do that. Just give you a refill without a visit or even a virtual visit. Dispense of your medication safely, check the expiration dates as we talked about, and discard them safely. Many times, a pharmacist or sometimes a clinic, a pharmacy, they'll have days where you can drop off medications, or they have big metal bins where you can drop them off anytime. But ask around for that so you can dispose of them safely. What is not safe is just throwing them away in the trash or putting them in the flushing them down the toilet. That gets into our water systems. And while I'm not sure that one pill of one person is going to do something, if a lot of people are doing it, then that can have an impact. So just to be safe, uh, get it to some of these places where you can dispose of properly. There's a question of why do I have to take so many medications? Um, there are they're just, let's see, the use of multiple drugs to treat diseases and other health conditions called pharmacy is a growing concern for older adults. It certainly is. People over 65, that's just the number that they use, I think, because of Medicare. They tend to take more drugs than any other age group because they have several diseases, medical challenges, etc. It can be hard to track, so we talked about that. Taking medications can increase the risk of side effects and unintended problems. So there's also this concept of, along with polypharmacy, to help to correct that, there is deprescribing to help older adults make sure they take only what is really needed. So in another word, that in addition to having it called deprescription or deprescribing, because you're to get the medications to prescribe to take away or to take it off is to deprescribe, right? Another term that I really like is called optimization. Saying like, okay, this list right here of medications is not providing optimal health because it's causing taking this particular drug is causing an issue, so you need another drug for that side effect. And that's called a cascade effect when you have to keep adding medications for different side effects and conditions that pop up. So optimization, as you might be able to tell from that term, is getting to that optimal level, number of drugs, dosages of drugs, the right types of drugs for you for optimal and healthy living. So that's really what you're looking for, and you want to work with your doctor and even bring it up. I would even bring it up if you have a long list, and typically we say that's five or more. If you have a long list, it's important to bring that up to your doctor. Some will not bring it up. Some are not confident in bringing it up. Some are nervous about asking. Maybe they've had negative experiences with other patients who don't want to stop taking any of their medications. Maybe they've tried this before. But if you show that interest and you ask them in a kind way, I bet that they would walk down that road with you and help you optimize your list of medications. So it is important. And like I said, I highly encourage you to bring it up, even if they do not, if you have concerns, if you have five or more drugs, to just say, hey, is this something that I really need to be on? We may have time in another video to talk more about deprescribing and optimization. I'll close out with this last list on taking medication safely, and then there's a little bit of information, some frequently asked questions that I won't have time for. Um, but let's do this, and I encourage you to, as always, to come see this article on your own. Taking your medication safely, follow the instructions, take your medications on time, and there's more information. I'm just hitting the bullets. Turn on a light. If you take medication in the dark, you might be taking the wrong medication, even if it feels right, looks right in the low light that you have. Report problems right away. Tell your doctor about alcohol, tobacco, and drug use. Be honest about that. Ask your loved ones for help. And that might be getting to doctor's appointments. It might be understanding what the doctor said. Might be help managing medications, taking medications. Check before stopping a prescription medication until it's finished, and don't share medications prescribed for another person or give yours to someone else. All right, and there we will end this long and comprehensive and excellent article on medications. We'll continue with medications in the next video because there's just always so much to learn. So please stay tuned for all of these. We thank you for you participating in these videos and watching. We hope that you'll like it. We hope that you'll share it, not so we get clicks, but just so we can help as many people as possible. So if you found this helpful, please consider doing that. Thank you for joining me for this Caregiver Coffee, and I look forward to seeing you next time. Take care.